So defining operability in non-small cell lung cancer is quite a challenge because unlike breast cancer or prostate cancer, which are organs that we do not need to live, lungs are pretty much needed to live. So meaning that when we assess operability, we have to look to three different factors. So the first one we'll call oncological operability. So meaning that in this particular patient, performing surgery will improve the likelihood of cure compared to other strategies like radiotherapy or others. But the ones that I've talked during my speak today was two ones. So the one was the functional operability, what you say about patient comorbidity. So in this case, what we do is that we follow the ESTS, ERS guidelines, and we perform a cardiac assessment to all of our patients, a non-invasive one, and then we perform pulmonary function tests in order to understand what's the vital reserve and the cardiac and cardiovascular and pulmonary fitness of our patients. And then we just follow the algorithm. Sometimes we have to also include some exercise testing in order to make sure that this patient can indeed tolerate surgery, and also the extent of surgery that we can do. So this is the functional operability. But then we have the technical operability, which is, like we're saying, it's based on tumor size, location, relation with other structures in the thorax. And this is based on anatomical criteria. And the aim here is to make sure that we can do a procedure with clear, nice, clean pathological margins. So nice, clean surgical margins with no involvement by microscopic or macroscopic gross tumor. And to determine that, sometimes it's complicated because while in stage 1, stage 2, usually this is feasible, the problem is about stage 3, which is a very heterogeneous disease where we have from very small tumors to these huge tumors invading all kinds of structures like vessels, the diaphragm, the spine, which are very challenging to operate on. And we also have different degrees of lymph node involvement. So it can go from 0 to N2 bulky and 3 invasion, which are usually considered unresectable.